graduated from residency in 2004, it didn't take long into my practice before I recognized I was not well equipped enough from my conventional training to adequately treat hormonal issues that my patients were coming to me with. And they were coming to me with these issues a lot. I had learned in medical school and in my residency training that the options were birth control pills, or if they were an older patient who was going through menopause or had gone through menopause, maybe a synthetic hormone like Premarin or Prempro, were really the only tools I had in my toolbox to help these patients. And so early on, I started seeking out additional training about bioidentical hormone replacement. My interest in this topic has amplified recently because I turned 50 this past year, and I'm noticing hormonal fluctuations in my own body. And so I am very interested in learning how to optimize those hormones to feel my absolute best. So here are some things that I have learned from my hormone training that I have been seeking extra information about for a couple of decades now. First of all, progestin is not progesterone. They're used kind of interchangeably in conventional medicine, and they are similar but different. And progestin has some side effects and some adverse effects that we need to be cautious about. And it's not good for long-term use. Progesterone, on the other hand, is a naturally occurring hormone in our body that can be compounded and replaced that is very, very good for you. Progestin can increase the risk of breast cancer. Progesterone protects against breast cancer and can help you feel really good too. Progesterone levels decline in our younger years. I mean, they can decline in our 30s and 40s and can be the first sign of some hormonal imbalance. So progestin, very different than progesterone, even though they sound very similar. Um, the second thing I learned was that bioidentical hormones don't only help you feel better, they actually protect you from chronic disease. Chronic diseases like osteoporosis, Alzheimer's disease, and heart disease. I actually heard one of my mentors say this, and I had thought this was a very profound statement, that the lucky patients are the ones that have symptoms of hormones significant enough to cause them to seek treatment because they are the ones that get the life-saving benefits of being on hormone therapy. The patients who just breeze through the change of life don't seek out care and they miss out on the protective effects of being on hormones. I've never thought of it that way. And I think most patients think if they breeze through the change and they don't have too bad of hormonal symptoms, that they're lucky, when in fact, they can be the unlucky ones because hormones done correctly can prevent you from having chronic disease. So it's a win-win. You feel better on hormones and they make your health better as well. Of course, it has to be done correctly. They have to be bioidentical hormones. They have to be dosed based on salivary testing. We're shooting for the mid-range of normal, not too high, not too low is the sweet spot. So not all hormone therapies and treatments are equal. This has to be done right to get the most health benefits from it. And the last big thing I've learned from my hormonal training is that adrenal fatigue is real. As a conventional doctor, I didn't believe it was real, and I wouldn't have known how to treat it even if I did believe it was real. But it is real. I see it again and again and again, and it's really the first step to treating hormones. If you are somebody like under the age of, I don't know, maybe say 47, 48, and you feel like you have a hormonal imbalance, fixing and treating the adrenals is the place to start because the adrenal glands are two small glands that sit on top of each kidney, and they make two things: DHEA, which is a precursor to our sex hormones, and cortisol, which is our survival hormone. If our body senses too much stress, it is going to appropriately prioritize survival hormone over the sex hormones, and we're going to get hormonal imbalances. And so identifying that and fixing and treating the adrenals can go a long way to restoring hormonal health. And the last thing I'll say about adrenal fatigue is In this week's blog, I talked about many things you can do to help balance your hormones. And it's true, many of them are lifestyle things with diet and exercise and sleep that all make a huge difference. Sometimes, though, we're feeling so bad that we're having a hard time doing those things. We know we should eat better food. We know we should get to bed earlier. We know we should be exercising, but we don't feel good enough to actually do those things long enough for them to take hold and fix the problem. And getting support for your adrenals and helping get those fixed can give you the energy you need to do the things you know you should do, but are having trouble following through with. So, hormones are amazing, and having them balanced and optimized can make a huge difference in how you feel in life. I love to help people get beyond the line of fine. Many of my patients come to me and their labs are pretty normal from a conventional standpoint, but they don't feel great and they want to feel their best. And I think it's so important to feel our best because when we feel our best, we can be our best selves in the world and we can contribute our unique gifts to the world in our best possible way. And the world needs us.